So today we're going to talk about the uterine tubes as well as the structure of uterus. So as we know that uterine tubes are paired tubes that connect the that help in transport of the ovary. They're connected and they're supported by different kinds of ligaments and mesenteries. This is something we already know from anatomy. So a uterine tube actually has four main parts. It has starting from, okay, I don't know how to show this to you. Wait, but okay. So the most external part that is very close to the ovary is known as the infundibulum. And it is funnel shaped when it has these struck finger-like projections known as fimbriae as to facilitate the movement of the ovum. The next, above, as we move around it, we see the ampulla. Now, this is the main site of fertilization. This is where fertilization normally occurs. And as we move ahead of it, we see isthmus, and as the uterine tube converges into the uterus, we see a part known as the intramural part. So this is very important because it has four main parts: infundibulum, ampulla, isthmus, and intramural. I will send a picture of it. I can't annotate this, but let me try. Yeah. So this, I'll send another picture of it along with this presentation. So yes, so we're going to talk about the composition of the uterine tube. So like we've learned in GIT and every other system so far, we know that we see mucosa, submucosa, muscularis, and serosa. So here as well, we will end up seeing those. So mucosa is this is the pattern that we're going to learn uterine tube in, because this is how it's also very this actually helps in identification of the slides, the histological slides. So this is why this, I would say, is an easier way to remember it. So the mucosa is extremely folded because this is a very important characteristic feature. As you can see in the picture here, the mucosa is extremely folded. Do not confuse this with the seminiferous tubules of the male genital system, because they look very similar but they're not the same under in a histological site. So now we talked about how the mucosa is extremely folded, and it is very folded in the ampulla, the site of fertilization. As we know, it has simple cuboidal epithelium, and it has two kinds of cells. It has ciliated cells. These actually help in like the uh, this actually help in the movement of fluid as it moves towards the uterus, and it also has secretory PEG cells. Now, these cells are special cells. They are not ciliated. They are darker than usual, and they have an apical bulge. They bulge into the lumen of the mucosa, and this is because of the fact that they secrete certain glycoproteins which covers the epithelium, and it forms a basic film over the epithelium. It has a rather protective function. Yeah, and we know lamina propria is just the loose connective tissue. So other than that, the submucosa is normal. It is just a dense connective tissue with blood vessels and lymphatic tissues. In the muscularis layer, we have a circular layer and we have a longitudinal layer. Both of them are made of smooth muscle cells, and serosa is just like in the a continuation of the visceral peritoneum that we see. Now, that's about it, I would say, about the uterine tubes. Yeah. That's about it. And now let's talk about the uterus. The uterus is the female reproductive organ. It is the main female reproductive organ. It is pear-shaped and it is very thick in nature. So it is an organ that joins that this is the organ where the uterine tubes open into, like the intramural part opens into the uterus, right? So it has four main parts. So as you can see, I've written some letters here in this diagram that I'm trying to explain, which is a simplification of this diagram, where you can see the labeling of endometrium, myometrium, and perimetrium. So in here, what I'm trying to talk about is the topmost part is also known as the fundus. Then we have the isthmus, then we have the cervix, and we have the vagina. So these are the four main parts of the uterus: the fundus, the isthmus, the cervix, and the vagina. And we see many layers of the uterus. So the uterus has a very outermost layer known as the so it has three main layers: the perimetrium, the outermost layer, the middle layer myometrium, and the innermost layer endometrium. So the perimetrium is just a covering layer, so it's again connective tissue layer that serves and that is actually in continuation with the serosa as well as the peritoneum. The next is the middle layer, the myometrium. So myometrium, you can take what you can take away from the word is simply the fact that it is composed of muscles. It has smooth muscle cells, and it is very well vascularized with its own arterial plexus, venous plexus, and lymphatics. And during pregnancy, this is the layer that actually undergoes hyperplasia, and this is the layer that undergoes the contractions during labor, and this myometrium is supplied by arcuate arteries. This is something that you'll often see in MCQs, like myometrium is supplied by arcuate arteries, straight arteries, spiral arteries. So just know they're supplied by the arcuate arteries. Now, the endometrium, and the most important layer that we have seen here is that even in the picture, you can see we have the outer layer perimetrium, the muscular layer myometrium, and the innermost layer endometrium. So now this layer is actually the layer that undergoes changes during the menstruation or female menstrual cycle. It serves. You could say that it is the mucosa of the uterus in a way. It is lined. The endometrium is lined with simple cuboidal epithelium, again with ciliated cell and secretory plexus, the same as the uterine tube. And here we see a characteristic feature is that in its mucosa, we actually end up seeing collagen fibers. Mhm. And the endometrium itself has two main zones. It has a basal layer and a functional layer. Now, the basal layer is right next to the myometrium. So it's very cellular. It's highly cellular, and it has just like it has the ends of the uterine glands, and it's supplied by straight arteries. Whereas the functional layer is rather spongier. It has more cell organelles. It has most of the uterine glands length, and it is supplied by the spiral arteries and the vascular lacunae of the placenta. And out of these two layers, the functional layer is the only layer that undergoes changes during menstruation, not the basal layer. So this is extremely important that you know that the perimetrium does not undergo any change during menstruation, the myometrium does not go any change during menstruation, and the basal layer of the endometrium also does not go under any change during menstruation. Only the functional layer goes under changes. That's it. And the functional layer is supplied by spiral arteries, the basal layer by the straight arteries, myometrium by the arcuate arteries. So these are just like one markers that you will see in your exam. You could see. That's about it. I hope that made sense. Thank you.